My name is Melissa Davis. I am a family nurse practitioner. I work for 5 Points Pediatrics, and this will be my 5th year with Cooperative Health.
Hi, my name is Tabitha Garner. I'm a family nurse practitioner here at Cooperative Health. I started in 2010 and I currently am located at Waverly Family Practice.
Hi, my name is Mary Casey. I am at 5 Points Pediatrics. I'm a nurse practitioner and I've been with the Cooperative for 20 years this April.
My journey as a nurse practitioner was kind of a long one. I did not know at first what I wanted to do with my life coming out of school, so it was actually my mom who gave me a little nudge to go into the nursing field. I first started out as a certified nursing assistant first and proceeded into nursing school, and it wasn't until nursing school where I realized that I did actually have a passion for healthcare and helping people. And after working 10 years as a bedside nurse, I wanted to take a more independent and primary role as a healthcare provider. So I went to NP school, and 5 years later, here I am.
I initially became a registered nurse in 2002 when I graduated with my associate's degree at Johns Hopkins Community College in Virginia. I went on to work as a registered nurse for a few years and then returned and got my Bachelor's of Science from the University of South Carolina Upstate in 2005, and later returned back to school and received my Master's of Nursing from the University of South Alabama in 2010.
I had many surgeries when I was younger. I was in the hospital for lots of problems with my ears, and the last surgery I had was in my early teens. And at that time, there were candy stripers in the hospital who came in and visited every day. And I thought, wow, I think I would like to do that for somebody if they were in the hospital. So when I got in my last year of high school, they offered volunteerism at our local hospital, and I became a candy striper. When I finished high school, I started my associate's degree in nursing at Greenville Technical College. And when I got out, started working at Greenville Hospital System. About 10 years later, I decided that I needed to go back for my bachelor's in order to be a charge nurse in the hospital. And then 10 years after that, I decided I think I'd like to do more. So I went back and got my master's degree. And in 2000, I sat for my certification as a pediatric nurse practitioner and started working at Eau Claire the next month.
I think nurse practitioners are very vital and important to the cooperative health mission. We definitely increase the access to healthcare that our community definitely deserves. Our practices, we get overwhelmed sometimes, and having extra healthcare providers, including nurse practitioners, help to lessen that burden.
I feel that everyone is important to carrying out the mission of cooperative health and acting in the spirit of the Good Samaritan. However, I think that nurse practitioners are important because for each one of us that are here, we have contact. We act as a point of contact for thousands of people in the community to make sure that those lives are as healthy as possible.
I think nurse practitioners are essential to the cooperative health mission. When I first started becoming a nurse practitioner, my answer for patients was, doctors diagnose medical problems and nurse practitioners diagnose problems with the whole person, not just the medical part. I've worked with so many doctors here at the cooperative that diagnose the whole person and treat the whole person. So that's not my pat answer anymore. But I feel like nurse practitioners specifically meet the mission because in the spirit of the Good Samaritan, I'm not just looking at your ear-infected child. I'm looking at the fact that you're now homeless and living in a shelter, and your child's getting sick because they're with other children at the shelter who are sick, and mom needs this and baby brother needs that, and probably now we need flu shots and things to protect us while we're in a large group of people. So I think nurse practitioners can fill that role of looking at the whole person and the whole family, and not just at what your one specific need is today.
While there are many choices to pick from with regards to meaningful moments that I have with my patients, definitely getting to see them from birth and watching them grow up. And in the 5 years that I've been here, I love seeing the newborn babies that I first started with, and they're now heading off to kindergarten. But I do want to talk about, a little light-hearted, funny story. I wear a lanyard, I had one that had Disney princesses on it. And I had a 4-year-old that I was doing her checkup and she was admiring it. And I asked her, "Who is your favorite Disney princess?" And she looked at me and she said, "You are." So that made my whole year.
I don't know that I have one particular meaningful patient moment, but what is very meaningful to me is the trust that our patients have. I have had patients that have followed me from one office to another, initially starting in Brooklyn Casey, and then when I moved to Pillion, they followed me there, and then I have some that have picked up from Pillion that have followed me here. So just knowing that our patients trust me enough to feel like they can have me long-term as their provider means a lot. It also means a lot when they trust you to bring in family members to also care for them, which happens several times. Is important when they bring in a husband or a child or sisters. And in the time of the pandemic, I feel it is also important when people trust us enough to ask us questions about vaccines that they may not understand. So for me, the meaningful part is having that trust be encompassed with each patient that we serve.
So I guess the question was a meaningful patient moment. I have many every day. It always makes me feel good when someone comes back and says, "Oh, you told me to try that thing and it worked." But I think the more meaningful moments to me personally have been when I'm at the grocery store or I'm at the park or I'm taking my walk in my neighborhood and I hear, "Dr. Casey" or "Miss Casey," because they still call me doctor, even though every time I tell them when they come, I'm their healthcare provider and their nurse practitioner. They feel like I care for them, and that's my role as their doctor. And to have a young one run across the park or come up in the store and hug me and tell me, "Oh, we love you so much," and "You take such good care of us," or "I remember when you took care of my child, and now I'm having children." So just those moments where people remember that you were kind to them and remember that you tried to make a difference in their life, I think that is the most important moments to me.